Chief Executive of Cerebral Palsy Scotland, and joins us now. Good morning to you.
Good morning.
Perhaps we should begin with, for our listeners, can you outline what cerebral palsy is?
Absolutely. Well, cerebral palsy is a neurological condition. It is caused by damage to the brain, but it's caused before a child is the age of 2. So it's very early. It could be caused before birth, during birth, or immediately after birth. The key thing is that the brain damage won't change throughout life, and people with cerebral palsy go on to have a normal life expectancy unless they have other conditions. And what they can do throughout life will change because of their cerebral palsy.
Would it be fair to say that there are more adults living with cerebral palsy now than ever before because of increased levels of prematurity or better outcomes for babies having difficult births?
Not necessarily. There's about 1 in 500 births result in a diagnosis of cerebral palsy. But what has improved is neonatal care. But the diagnosis has remained fairly static. I think the other thing is, though, that with the access to help, people can lead very long and fulfilled lives.
And how many adults are living with cerebral palsy at the moment?
That's a really good question. We estimate about 130,000 adults are living in Britain at the moment. But actually, that's one of the problems, because people with cerebral palsy aren't properly counted. So there's an awful lot of people that aren't known to statutory services.
So let's talk about what services people with cerebral palsy have access to. What challenges do they face when it comes to getting adequate care?
Well, what happens is that most care is concentrated in paediatric services, and it tends to be directed from a very early age because it is something that happens. The brain damage happens before the age of 2. And so it tends to be directed by a paediatrician, and they then will direct to lots of other services like physiotherapy or occupational therapy or speech and language therapy or whatever is required. And there is quite a multidisciplinary approach in paediatric services. And then what happens is that there comes a point where paediatric services want to hand over to adult services, and there is no equivalent of the paediatrician, and there are no specialists for adults, clinical specialists in the management of cerebral palsy for adults. And so there's a moment where people describe that they're just falling off a cliff. So having had relatively joined up multidisciplinary services as children, if they want to see a physiotherapist, they have to be referred through their GP like everybody else.
And so when you're saying they're treated like second-class citizens who don't get the same treatment on the NHS as other lifelong illnesses, is that because there isn't an adequate package of care?
No, there's just not an adequate understanding of ageing with cerebral palsy. And what's so frustrating is that NICE, who is the National Institute for Health and Care Excellence, actually understood this problem. And in January 2019, they published guidelines for care and support for adults with cerebral palsy that from across the UK we all fed into, and that recommends regular review, access to services from people who understand cerebral palsy. It's not a very big ask.
And, there are, in purely economic terms, there are benefits, aren't there, to this parity of care for people with cerebral palsy. A lot of people with cerebral palsy work, don't they? And
absolutely. And we came across at Cerebral Palsy Scotland, we did some research and with the University of Glasgow, and they came across this awful statistic about people who are walking and working in their 20s and 30s at that time, and this was a few years ago, 10 years ago, at that time, they could find no one who was walking and working in their 50s. So you think of the economic impact on society for that. And we begged the question, well, why on earth was that? And could, with the access to the right care and support, we enable people to continue being, being able to work and being able to be independent?
Why is this only coming to public attention now? I mean, if the number of people with cerebral palsy, adults living with cerebral palsy, hasn't gone up more, why hasn't this been addressed previously? What's happened to all those adults living with cerebral palsy who haven't had parity of care?
I think in the past, too many people have just been told, well, there's nothing we can do. It's about, it's all down to your cerebral palsy. So don't be surprised when things decline. And I suppose what's changed? Well, for a start, it's really lovely of you to highlight it, because we need to highlight it. We've begun to come together as a Cerebral Palsy UK group much more, so we're sharing experience, research, and we're experiencing different ways of how we can support adults, and therefore how much better it would be if the NICE guidelines could be adopted. The other thing I would say about cerebral palsy is I always feel we're the second-class neurological condition, because you are diagnosed so early in life, you don't know anything different. You live with cerebral palsy, so there isn't this traumatic before and after that other conditions have. So many other conditions have huge campaigns because somebody famous or has been diagnosed with the condition, whereas cerebral palsy, we just live with it and get on with it.
Yes. I can see exactly what you mean there. That's Baroness Stephanie Fraser, Chief Executive of Cerebral Palsy, 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 Chief Executive.